Welcome to the Take Your Life Back Summit, your roadmap out of chronic pain, fatigue, and autoimmune disorders. And I'm your host, Dr. Heather Yost. Today's special guest is Dr. Joe Tatta. Joe Tatta is actually a doctor of physical therapy, and he teaches you how to retrain your brain and body so you can live the joyous and pain-free life you deserve. He's a best-selling author of Heal Your Pain Now, doctor of physical therapy, board-certified nutrition specialist, and functional pain science expert. He is known for integrating broccoli, neuroscience, mindset, and movement into easy-to-implement treatments for lasting pain relief. Dr. Joe's mission is to compassionately and quickly heal your pain and reverse our global pain epidemic. You can contribute to the conversation weekly as he hosts the Healing Pain podcast, or work with him online by joining the first ever integrated pain relief program, Heal Your Pain, Heal Your Life. Learn more at drjoetatta.com. Thank you so much for being here, Dr. Joe.
Thanks, Dr. Yost. I'm so excited to be here and talk with you today.
I know I've really been looking forward to this conversation, and I think that you have so much to offer our listeners. But before we dive into what that is, could you just expand a little bit on what's your story? How did you get to where you are?
Yeah, it's a great place to start. I like a lot of us, we have, various roads that have all led to Rome, so to speak. But the first thing in my life was my mom was a nurse who worked in pediatric cancer medicine. So when I was a kid, I was about 8 years old, she would, take care of me and my brother and the house and the dog and the dad, all the things that, active moms do. And at night, she'd work the night shift and she would take care of other people's kids who were, at that time terminal. This was the 80s when we didn't have such advanced cancer medicine the way we have it today. So she worked the night shift. So she did that for a number of years, actually full time. And as you know, having the house and the kids in the family and the job at night is a big burden. And she wound up with chronic pain. She wound up with digestive problems, fatigue, anxiety. And I really watched her go from someone who was obviously the pillar of our family, and in a lot of ways the pillar of our community, helping other people, because as healthcare practitioners, we're always helping. And I watched her become the person who needed help. So that was the first, through the lens of a child, through a child's eye, I watched that happen. And then through, my life, I was a competitive gymnast. I was always into sports and activity and the body. And then I've also had my own struggles with chronic back pain and autoimmune disease that have, left me in a state of chronic pain at times. And I've learned how to heal all those naturally from not only my training and my studies, but also my entire life experience.
That is amazing. And I love how you said the solution doesn't come in a bottle. It comes by educating and empowering yourself about what pain really is.
Yeah. And, it's a great place to start. And I think when people say that, as we talk to people with pain, we really want to step forward compassionately. Mm-hmm. So when people hear the word pill or bottle, they say, well, you don't know what it's like to have pain. You don't live with pain. You're not in my body. You're not feeling what I'm feeling. So the first thing is, look, your pain is real. There are people who understand your pain and there are ways to help it. And when it comes to pills, there may be a time where they serve their place. And oftentimes that's in the beginning of, let's say, a pain episode or a pain flare. And what I really try to educate people on, it really should be the lowest dose for the shortest period of time and only integrated with other natural, healthy strategies, the ones that we're probably going to talk about in today's interview.
Right. Ooh, I love that you said that. I agree. There's a time and a place, but you can't forego doing what you can on your own as well. Could you go into what exactly is pain and why is it not what we think it represents?
Yeah, it's a great question. So we know pain pretty well as far as acute pain goes. That makes sense to us. Right. So if you fall and you scrape your knee, or you trip and you sprain an ankle, or maybe you fall and you fracture your arm, those are all acute versions of pain, basically. Now with acute pain, your body has an incredible ability to heal itself. It's called the inflammatory process. And in some ways, inflammation is very beneficial, because it's in charge of that repair and remodeling phase. So it'll take that damaged, injured tissue and it'll repair it so you now have healthy bone again, or healthy skin, or healthy ligament. Now, the inflammatory process, that healing process, is very predictable. We know that on average, it takes anywhere from 12 days to 3 months to heal from an acute injury. So within about 3 months, no matter what your pain is, your body will heal it. Now, when we talk about chronic pain, which is what we're talking about today mostly,
right.
Chronic pain is something that's very, very different. So with chronic pain, that's when pain persists beyond a 3-month period of time. And we start to look less toward the tissues and more toward the brain as to why this chronic pain state has persisted.
Right. I'm glad that you pointed that out, that it's two different things and we have to look at it differently. What would be the first step for those with chronic pain? Say, what's the first step for them in the healing process?
Well, I think it depends on what type of pain you have, of course. Everyone's pain is very unique, but there are principles that apply to everyone. Now, if you look at our chronic pain epidemic, we have about 100 million people who struggle with chronic pain. Out of that 100 million people, probably about 50% of those have an autoimmune disorder or an autoimmune disease. So there's some type of chronic inflammatory response that's happening in the body. Either it's low grade or it's high grade, as you have with autoimmune disease. So for those people, and for the majority of people, we have to look at nutrition first. So nutrition is the way that we decrease inflammation, that we heal pain 100% naturally without the use of drugs, needles, injections, surgeries, all those things that we have used over the past 50 to 100 years that we're now seeing really don't work for chronic pain.
So if nutrition is where it's at and can heal it naturally, what is the best diet for those with chronic pain and or autoimmune disorders?
Well, it's on a spectrum. So most of us, when it comes to healing from our pain, you lie somewhere between a Mediterranean and a paleo diet in some way. So in some version, you're going to have to get some natural anti-inflammatory foods in your diet, and you're going to have to heal your gut. When you get the anti-inflammatory foods in your diet, and you work to heal your gut, you will decrease inflammation naturally. And when inflammation goes down, your pain is bound to go down very, very rapidly, sometimes within 3 to 4 days, faster, in fact, and safer than many of the anti-inflammatory medications that we sell over the counter and that are given out like pills to a kid in a candy store. We can heal this 100% naturally, but oftentimes it's with a food-forward approach. And often, this is the one thing that traditional medicine is really not talking about. When you walk in and you say, my joints hurt, my back is stiff, my hip range of motion is poor, oftentimes we're looking at these pills instead of the food as the way to decrease inflammation.
Yeah, that's huge. I think it's worth pointing out that medical doctors really aren't trained about the food. That's not their box. So it's not that they withhold the information, it's that they just don't know how important it is. When we look at healing your gut, what do you mean by that? Can you help our listeners understand a little bit more about what does it mean to heal your gut and what does it take?
Sure. I mean, your gut is the home to your immune system. Most of us think about our immune system as these cells that are floating around our body, and they attack bacteria and viruses when you have an infection. And to a certain extent, that's true. But when you really get deep into the science of this, gut healing starts with the immune system that is located in your gut. Now, if you're eating foods that cause something which is called leaky gut, whereas your cell has a really small lining. They're little cells that are lined up next to each other. With leaky gut, those cells kind of split apart, and things can pass through the lining of your gut that shouldn't pass through, like viruses, like bacteria, like toxins, like foods that are partially digested. Now, if that just happens a little bit, okay, you have a little bit of low-grade inflammation, you probably don't notice it. But when this happens day after day, and you keep eating the foods that cause leaky gut, eventually you have inflammation that rages not only through your gut, but you get what's called extraintestinal symptoms, so symptoms that lie outside of the gut. What are those symptoms? Joint pain, muscle pain, tightness, headaches and migraines, brain fatigue, body fatigue. All of these are symptoms of leaky gut. So oftentimes we're looking at the joints, they're red, they're swollen, they're painful, they're stiff, and we're trying to figure out, okay, how to heal the joint. And there is a place where we actually go to the joint and work on it. We'll talk about that later. But oftentimes healing the gut is the first place to go.
Do you have, in your opinion, a number one food that causes leaky gut or a top 3?
I do. The number one food that causes leaky gut is gluten. And when we look at gluten, we know that 1% of the population has an autoimmune condition called celiac disease, where they are highly allergic to gluten. about 40% of the population is intolerant to it, which means when they eat it, they'll get varying symptoms, sometimes immediately, sometimes over the course of 4 to 7 days. But when we talk about people with chronic pain, that I see in my practice, Dr. Yost, upwards of 90% of people with chronic pain have an intolerance or a highly intolerant or allergic to gluten on some level. So that is the first food to pull out. And when you pull that food out within the first 30 days, you will see your pain go from a 9 to a 0 within 30 days or less. And oftentimes it can be within 4 days.
That's awesome. I think that gives a lot of hope to people, because that 30 days is not a big investment in the rest of your life. Go ahead.
No, it's tiny. And again, we're learning, and we want to be compassionate. So we want to find cures as fast as possible. But we're learning there's no magic pill. But once you find the magic formula, once you find the part of your pain puzzle that helps you, and diet is really a big part of it, you can start yourself healing with, like I said, within 4 to 30 days, immediate drastic pain relief.
While healing the gut is what you're saying too.
That's right. Yep.
Right. You mentioned in a lot of your work, a ketogenic diet. What is that? Where's that on the spectrum? And when would you use that?
So a ketogenic diet is oftentimes where I'll go last, but oftentimes it could be something that can really, kind of shift the needle. So I love a ketogenic really for 2 reasons. The first is when you're on a ketogenic diet, it's a high fat, low carbohydrate, moderate protein diet. And the type of fats that are in my diet are not the type of fats you find from saturated fats or the type of fats you find from animal fats. We're talking about natural, healthy, anti-inflammatory fats that you find in cold water fish. The omega-3 fatty acids obviously are really important. Mm-hmm. The fats you find in olive oil, the fats you find in avocado, the healthy fats you find in nuts and seeds. So fats are inflammatory. Fats can decrease inflammation. Fats are also fuel for every single cell of your body. So every cell of your body, kind of like this mouse, if you look at this mouse, it looks like a cell. Every single cell of your body is surrounded by a fat layer. And the way your nutrients get into the cells to make energy, to make ATPs, it has to pass through that fat layer. If you don't have the optimal amount of fats around your cells, the nutrients can't get into your cells. They can't get into your mitochondria to produce energy, to decrease that fatigue that you feel each and every day when you wake up. So fats are the first thing as far as decreasing inflammation. The second thing, as we start to talk about the brain in pain, there's something called central sensitization. So what does that mean? It's kind of a big fancy kind of neuroscience word, and I love talking about neuroscience. So central sensitization means that your brain is in an overreactive, hypervigilant type state. Now, where do we have the initial proof and studies from this? It actually comes through those that have a seizure disorder. When kids have a seizure disorder, sometimes they put them on a ketogenic diet, and it helps quiet down their overly reactive nervous system. The same thing happens with the ketogenic diet when it comes to chronic pain. Now, what's the real science behind this? The real science is that there are 2 neurotransmitters in your brain. One is glutamate and one is GABA. When glutamate is really high, it's excitatory, and it pushes GABA, which is a relaxing neurotransmitter, to be really low. So with a high-fat diet, with a ketogenic diet, you decrease that glutamate, you increase GABA, you quiet the nervous system, and automatically you feel better. It's a wonderful, beautiful thing. And the best part about it is that people love eating fat because it tastes good. So they're not worried about a little bit of bacon. They're not worried about the extra fat that comes in their meat or their seafood. It can all go in the diet. And actually, fat actually even helps you lose weight because it satiates you even more.
Fat's really gotten a bad rap over the years.
Fat has a bad rap. I mean, I love it. When I look at every single plate that I make for myself, I'm like, where's the healthy fat? Bring it on, because it helps me heal. It keeps me skinny and it gives me energy.
That is awesome. People need to hear that more often. How would you begin somebody on a ketogenic diet? And I guess my other question would be, because you said you use it as a last resort, would you recommend people starting this, or should they really be under the guidance of a doctor?
So here's when you start a ketogenic diet. If you've tried a modified Mediterranean diet or a whole foods diet and it's failed you, you can start thinking about it. If you've tried every gut protocol under the sun, where you've eliminated all the inflammatory foods, then the ketogenic diet is your next phase. Now, what are the keys to a ketogenic diet? Obviously, it's increasing that fat like we spoke about, but it's also decreasing the carbohydrates. So all your grains have to come out. all beans have to come out, and most of your high starchy vegetables have to come out as well. So when you look at like things like white potatoes, those things have to come out of your diet, unless you're super active and you're doing things like high intensity interval training, or you're running for a marathon or something like that. Then you can include a little bit into your diet. But even then, to really hit a state of ketosis, very, very small amounts of carbohydrates.
And high amounts of fat.
And high amounts of fat.
Not necessarily high amounts of protein.
Yeah, and thank you for bringing that up, because I think the challenge with the ketogenic diet is people say, well, I cut all my carbs and I just felt tired and nothing happened. And I always say, where was the fat? Because people don't realize that you have to put a lot of fat into the diet to really hit ketosis. So when you're looking at the ketone bodies that hopefully you're testing in your urine a couple times a day.
With easy little strips from Amazon, right? Easy
little strip. You don't need a blood test. You don't need any specific like breath, test. Just a little ketone strip. Super easy. Easier than testing your blood sugar for diabetes. A couple times a day, you pee on the stick. It should turn purple. And if it does, you know that you're in the range and that the amount of fat that you have in your diet is appropriate to get you into ketosis and to help that healing.
How long do people typically have to stay on a ketogenic diet?
It's a great question. Now, obviously, if you have metabolic syndrome and you have a lot of extra weight and you're working on those blood values of metabolic syndrome, then you may need to be on it upwards of 3 months. Once you baseline to that sweet spot and your weight goes down, all your blood values regulate, and obviously your pain decreases, then I recommend that you cycle through a ketogenic diet for 3 weeks, twice a year.
Okay.
And why do I recommend that? One, it kind of resets your metabolism. And two, I believe from a Paleolithic perspective, we probably hit ketosis once or twice naturally in our yearly life cycle as a caveman, if you will. And that probably happened once in the winter when there wasn't a lot of food. And it probably happened once when there was a state of famine, either from disease or from the tribe basically coming in and stealing your food and all of your rations.
So in between the twice a year, 3 weeks on a ketogenic diet, once you've reached your goals, what sort of dietary guidelines do you recommend in between?
So once you reach your goals, I want you on a really good anti-inflammatory diet. And for most of my patients, that means that they're off gluten, dairy, and sugar about 90% of the time.
Does that change if there's an autoimmune disorder?
If they have an autoimmune disorder, then most people know that they really can't have the gluten, have the dairy. They can have a little bit of organic stevia for sweetness. But as blood sugar rises and your insulin spikes, inflammation is bound to rise as well. And when cortisol rises, which oftentimes rises with blood sugar fluctuations, cortisol can be pro-inflammatory. Cortisol has anti-inflammatory properties in a very, very small dose. But the problem with autoimmune disease is oftentimes that cortisol level is running really high and it's causing a persistent state of inflammation.
And could you expand a little bit on how you feel cortisol levels have changed over the years in our culture and society?
Yeah, I mean, obviously we looked at cortisol just on a basic blood test to see if you had, if your adrenals were functioning at all. And if they were totally bottomed out and had zero function, then we looked at it as if you needed help. Now we look at adrenals on a much kind of wider spectrum, and we look at cortisol not only responsible kind of for that fight or flight response, but when you really break down that fight or flight response and look at every single thing that's happening in the body, cortisol affects how you store pain memories. Cortisol affects inflammation in your body. Cortisol affects your blood sugar. Cortisol stores fat. Cortisol even has the ability to make certain muscles tighter and certain muscles looser. And oftentimes those are the muscles that are around your spine, the back and neck, which is why we have such a incidence of chronic back and neck pain in our society, because most of us are functioning in a constant state of fight or flight or freeze. And that freeze really is the one thing that no one talks about. And that freeze is when your muscles tighten and you go into spasm and you say, I need help. How do I get out of this painful state that I'm in?
For those that are in a freeze state, what's the first step? Is that nutritional changes, or is that the person that probably do need a drug management while they're changing their nutritional?
For me, the patients that are in the free state is where we look to the brain in pain, and we need to rapidly move you into a deep state of relaxation. If you're in that free state, your brain is stuck in that harm alarm phase, and it's outputting, so your brain is outputting pain as a sign of protection, as that big, red warning light. It's like the indicator light on your dashboard is constantly flashing, but there's nothing wrong with your car. That's what the brain in pain is. Your brain is constantly creating pain, even though there may actually be no harm. So how does that happen? So these are not the people with, I shouldn't say they're not the people with autoimmune disease, because sometimes they're in a state of fight, flight, or freeze as well. But these are the people who have had every test done, they've had every x-ray, they've tried every type of therapy possible under the sun, and they haven't found relief. But they've never got to the point where they've lowered that fear state in their brain. So Heather, when you live in a constant state of fear that pain's going to turn on, fear that every time you move, you're going to hurt, fear that no matter what you eat, inflammation is going to increase, fear that you're going to have another injection or another surgery or try another drug that is addictive, that causes dependence, or at times leaves you depressive and despondent. That keeps you in a state of fear. When you learn to decrease fear naturally, as fear decreases, pain relief follows rapidly right after it. So how do we decrease fear? Just talking about what pain is. So understanding the difference between chronic pain and acute pain is how you decrease fear. With chronic pain, it doesn't mean that you're damaged. And what I tell people is hurt doesn't equal harm. So with chronic pain, you can have a little bit of pain, just a little bit. You can kind of flirt with that pain. You can move a little bit with that pain and not worry about hurting yourself, because the damage isn't in your joints. The alarm is actually in your brain. So getting into a state of deep relaxation, whether that's meditation, whether that's hypnosis, whether that's learning about pain. One of my favorite techniques is what's called a meditative body scan, where you work on a meditative technique and you decrease the sensations, or you become very aware, mindful, and present about the different sensations you feel throughout your body. And once you take someone through this body scan and they move from their head to their shoulder to their hip to their feet, they realize, wow, this finger's tingly. I can't feel this one. My feet feel numb and my back feels painful. I had no idea they had all these different sensations. And through this mindfulness approach, you can turn off this pain signal in your brain. And oftentimes this is the one thing that no one's talking about, and it's what's missing from all the pain programs out there.
Is this part of what you teach in your book?
Yeah, I teach a concept called the brain in pain. So this is a big part of that concept, is learning why your brain is stuck in pain and the natural ways you can decrease that pain and get yourself into a state of relaxation, get yourself into a state of everyday calm and safety and decreased fear. And with that, what often follows is the anxiety decreases and the depression decreases, because, how many patients have you seen with chronic pain that are on an antidepressant medication?
Right.
And you look at them and you say, I don't think you're depressed. I just know that pain is really hard. And you've been struggling with this for a really long time. And to the traditional physician, it may look like you're depressed. But once we get started healing your pain naturally, both through the body and the brain, you're going to feel better. That depression is going to lift like a blue sky opens up, and everything gets better.
I think that you really hit home when you said that people that do have chronic pain fear every moment, every movement, fear waking up, fear it coming back, fear. I think that really hits home for a lot of people, which brings me to a topic I'd love you to address: movement. When people are in pain, the last thing that they want to do is exercise and have quality movement, and which then obviously breeds depression and weight gain, and so on. It's so on and so forth. So can we talk about why movement is so important, even if you are in chronic pain?
We sure can. Of course, as a physical therapist, movement is one of the first and, oftentimes most important aspect of healing pain. We know two things about pain. It's impossible to heal from pain unless you start moving again, and unless you change your mindset around pain. Now, the mindset we already spoke about. We already talked about how the brain is involved in the pain response and how hurt doesn't always equal harm. So your mindset's starting to change. Now, as fear decreases, there has to be a way that you start to engage with a little bit of healthy movement each day, more by more, on a daily basis, on a weekly basis, on a monthly basis. Now, Dr. Yost, you know as well as I do, when we tell people with chronic pain, I want you to move a little bit, they say, Heather, I hurt so much, moving is the last thing I want to do. But let's look at it like this. All of us, me, you, the person with an autoimmune disease, the person with chronic back pain, we all have a pain threshold. When you move and you hit that pain threshold, pain turns on. If you stop moving, so let's say today you could walk 2 miles and you hit the pain threshold. But then you say, I don't want to walk anymore. Walking causes my pain to increase. So you go from 2 miles down to 1 mile. Now your threshold has lowered. So that threshold is lower. Then you say, well, now I can only walk a mile. I'm going to go to 0.75 miles. And your threshold lowers. And then eventually it's a half a mile. And then eventually it's only household distances. So what I want you to do is what's called graded movement. So it's breaking your movement down into little bits and pieces. And a walking program is the simplest form of it. So let's say you can walk a mile without pain today. I want you to go out and walk a mile for about 3 or 4 times a week. And the next week I want you to walk 1.25 miles. And the week after 1.5 miles, and the week after 2 miles. And I don't want you to have pain when you exercise, but I want you to flirt with that pain just a little bit. I want you to bump up against that pain, and I want you to feel like there's an awareness that that pain is just about to begin before you stop. That's the sweet spot. Now, when you do that, what happens? Of course, you're getting stronger. Of course, you're getting more flexible, and you're bringing blood flow to muscles, but you're helping the brain retrain itself. You're helping the brain release healthy endorphins, release natural opioids that we have. Your brain has powerful natural opioids. Your brain is its own medicine cabinet that can release those opioids. But it only happens with a little bit more movement, week by week, month by month, and of course, year by year.
So in a sense, you're leveraging the brain to help in the healing process.
That's right. And the fascinating thing about movement is that when you move, almost every single part of your brain lights up. So you're retraining every part of your brain, whether it's the fear center, whether it's the emotional center. We know that pain has a large emotional component to it. So people are very fearful. They're also sad. They're depressed. They're angry about their pain. When you start to move, every single part of your brain lights up. And there's almost nothing that we have in our toolbox that can affect every single part of the brain other than educating people about exactly what the pain experience is.
So if I can reiterate sort of everything that you've said, when people are in chronic pain or autoimmune disorder, they need to change what they're doing nutritionally. They need to start moving their body, and they need to start relaxing the fear response in the brain. Mm-hmm. That's awesome. And I think so many people are going to feel there's so much value in those 3 things. So thank you for sharing. I want to make sure that I am telling the audience, how to find you. So they obviously can go to your website, and your book is Heal Your Pain. But you've gifted a free gift for everybody today too. Could you explain what that is?
Yeah, so my book is called Heal Your Pain Now. You can find it on Amazon or any retailer, online or offline. My free gift is a couple of interview series that I've pulled from some pain summits, where I interview people about the brain in pain. I interview them about emotions in pain. I interview them about past experiences in pain, so things that have happened in past childhood experiences that relate to pain, as well as the things we talked about today, nutrition, inflammation, and a little bit of healthy movement. I also have a great quiz that people can access. It's called The Pain Quiz. So if you go to www.thepainquiz.com, there's a great pain quiz that'll help you get to the root cause of your pain and find out what you need to do to start healing.
So these are all online things that they can do. How would somebody get a hold of you if they wanted to work more directly on a one-on-one approach with you?
So I have the first ever integrated functional pain science healing program online. It's called Heal Your Pain, Heal Your Life. You can go to that URL, healyourpainhealyourlife.com, or you can go to my website. You'll find the program there. And it's a 6-week program that I take you through all the integrated strategies. I walk you through a step-by-step process on how to implement this into your life so it's simple, that it's easy, and that you can start healing your pain right away.
That's awesome. Thank you. Before we start to wind down a little bit, though, I have to know, how do you integrate broccoli into your program?
Broccoli is one of my favorite foods. What I love to do is I chop up some broccoli heads and some cauliflower heads. I mix it with a bunch of coconut oil, and I throw in a bunch of olives, the green olives, and what I love, I'm Italian, so I love Gaeta olives, which is a specific olive from the south of Italy, and it's really high in antioxidants, and it's full of great, wonderful healing fat. So I put it in a big pan. I roasted it at 350 for about 30 to 40 minutes, and it's a wonderful way to get some healing properties into your diet.
That's awesome. So you prescribe that for your clients?
I do. Look, I'm Italian. I'm from New York, so it's always food first. Food's always on the table. Food is, it makes us happy. It heals your pain. Food is really a great thing to have in your life.
Well, I'm going to be putting that on my menu for the next week. I'll have to try it. Before we go, I have a couple of fun questions for you, especially since we talk so much about nutrition and dietary changes. If we were going to open up your fridge at your house, what would be 2 foods that we would see in your fridge every time?
You would find coconut milk and avocados.
Very good. Mine too. What about if you were stuck on a desert island and you could only have 2 products or supplements with you? What would you make sure you had on hand?
Is there sun on the desert island?
Yes.
So I wouldn't need vitamin D, then I'd get that naturally.
Yep.
If there were 2 products I would have, it would be an omega-3 fish oil and a high-potency bioavailable curcumin that's suspended in a little bit of MCT oil, so that's the fat that's found in coconut oil. And I've patented that, and I have that for sale on my website at drjoetatta.com.
Very good. Very good. Well, Dr. Joe, thank you so much for joining us. It's been a blast chatting with you. I learned a lot myself too, and I think you're bringing so much value to the world. I really appreciate being able to bring your value here to the summit as well.
Thanks, Heather. Let me tell you, this is a great summit. It's a great cause, and I really appreciate all the hard work you put into it, because we need to, band together and spread this message of hope and healing for the, really millions of people that have tried drugs and surgeries and injections and have not been able to find, both the physical and emotional causes to their pain. So thank you for doing this work. Absolutely. I know that through these podcasts, we're giving so many people hope and helping them to know that there's answers in healing. And it's on its way. They just have to educate and empower themselves. Great. Thanks so much for being here with me today. Yeah, thank you. I appreciate it. I look forward to working with you more in the future. Well, thanks, folks. You've heard it here. You must integrate broccoli into your diet. Thanks for listening. Please watch out for more from us. Dr. Heather Yost, Yost Wellness Centers. This is the Take Your Life Back Summit. We will see you tomorrow. Take care, be well, and have a great rest of the day.